Oh, yeah. Like these.
Morning, everybody. I'd like to call to order the public health meeting for Wednesday, September 20th, 2023. Clerk, please call the roll.
Juby,
Juby here.
Silva,
Silva is here.
Tarver,
Tarver's here.
Williams,
Williams here.
Young, Sanchez,
Sanchez present.
Strathman,
Strathman here.
Tuppy.
Deputy here.
You have an in-person quorum.
And we have a request for remote attendance by Mr. Tarver and Mr. Williams. Or do we have any objections?
Not yet.
None. Okay. So welcome online, gentlemen. Okay, I'd like a motion and a second to approve the minutes from August 16th, 2023.
Silva moves.
Silva moves. Do I have a second?
Sanchez seconds.
Okay, could I have a roll call, please?
Juby,
Juby, I.
Silva,
Oh, yes.
Tarver,
Tarver, yes.
Williams,
Williams, yes.
Sanchez,
Sanchez, yes.
Strathman.
Strathman, yes. Okay, this is the time of the meeting where we do our public comment. I do have some people signed up, excuse me, but it looks like nobody is speaking on agenda. Is that correct? Everybody's off agenda. Okay, so that will be moved to the end of the meeting. Welcome to you all. Okay. This morning we start with the financials are attached. My mouth isn't working this morning. The reports are attached. Are there any questions about them? Okay. And then it's over to Brett this morning.
Good morning, everyone. Oh, God, sorry. Good morning, everyone.
Woke us all up.
That's sensitive. I'm shocked. All my reports are on file if anyone has questions. Our next vaccine clinic is going to be October 29th. It will be our last clinic of the year. Some interesting statistics from that already. God, I feel like I'm screaming. I apologize. So far this year, we've seen 136 seniors for dogs and 52 seniors for cats. This is important because, again, this is what this clinic is designed for, this low cost ability for them to ensure that they're compliant. And we've already pretty much met last year's numbers, which is so exciting. We're also on pace to, again, have our highest clinic numbers. These continue to grow every year. Something we did in July, which is our break month, we put out a large Facebook post. Thanks to Julie's help, we learned these really cool things that we could advertise throughout the county. Our numbers have doubled since that with the Facebook, we've noticed. So that was a wonderful campaign we ran. It cost us around like $50 and it was just fantastic to helping get people in, get them to know about this. We also did a large push through a bunch of libraries, Carpentersville's, East and West Dundee, some of the Auroras to kind of hit some of the outskirt libraries to help get that information out to people. So that has been a huge success and we're very excited. And next month, it won't be next month because I want to reach the last clinic. November, I'll have all the details in a presentation for everyone for this year's clinic numbers. We're very excited about that.
I saw that the numbers really had jumped for July and that now I know why.
Yeah, so it's very exciting
Very good.
to do this. So we're real happy.
Yeah.
The other thing I said I'd bring forward was the generator is the emergency generator for animal control. We had the county company out and it was $88,450. So we did get those numbers in so we can discuss that. We also found out the heating unit at animal control is no longer working. And this is our heating unit that runs the animals. The repair on that is going to be $130,000. There's a 13-week lead to get a new heater in right now. So to rent a unit, because we all know that global warming isn't going to kick in and we're going to have a deep freeze because we all know that's coming with us not having a heater. To rent a unit is going to be about $20,000 for this time. So that's $150,000 at least for our brand new heating unit. We also have a leak in our roof that I'm waiting on quotes now for, and it's a design flaw in the way the crow's nests were built on top of the building. Since I started, we've had panel issues, we've had other issues with ceilings, and we finally got to the bottom. Henry's crew has been amazing. Learned it was these crow's nests that have been allowing water into the building and bugs. So bugs are another benefit. We can take care of it all at one time here. Because the wasps get in, they go in through the lights, they get into the animals' kennels, then we have to worry about stuff. So we've had to keep stuff in there to prevent against bugs and stuff like that. So it'll be nice to get that fixed. I just don't have a quote this year. The reason I'm bringing it before the board today is advice on what you'd like me to do. Animal control is a special revenue line. We do our best to try to afford everything we can without coming to the board. But this heating unit is a very large request. And with the purchase of the heating unit and the roof, which do not have a choice this year, I have to get those addressed. That then pushes the generator to the backside. For a facility like mine to be able to raise $150,000, which is what we're looking at for the heating unit, that's about 5 to 6 years worth of saving our pennies. So it's going to take us a long time to recoup any funds that we put out to pay for it. So I just wanted to bring it to the board and see if this is something you wanted me to bring forward in a resolution to see if the county would pay for, or if it's just something that's going to fall to animal control, in which case it's just going to push that generator back a couple years.
Yes, Mr. Tepe?
Thank you, Madam Chair. My suggestion would be that you do an emergency purchase order, okay? Work through with the building services people and with Madam Chair's office.
Mhm.
And put it through that way, because that way you can get it ordered and not have the kind of wait time that's needed.
Correct.
So that would be my suggestion.
And I have a question about that, then, is that something that he would be required to pay back? Or is that just to get the process rolling, or how does an emergency purchase order work?
I think it would be best to get some advice from Rogers Group as to how to properly classify that. You know, I don't think we want to in any way hinder financially what they do, okay? But the key thing is to get it taken care of as quickly as possible. And if you've got a 14-week lead time in getting the heating unit, it needs to get ordered.
Correct.
Yeah.
And I talked to building management about that. Sorry, Brett, again. We're waiting on 2 more quotes. So those 2 gentlemen companies, excuse me, are supposed to be out here within this week, next week. Once we have the final quotes, we can move forward with the emergency purchase.
Yep.
It just became then a funding issue. Animal control can pay for it on the front end. It was a question if the county would be willing to reimburse on the back end, is where that was kind of my question of how you want to put forward on that.
Anybody else have any comments about this? Yes, Ms. Juby?
I'm okay with the county paying for it. I don't want to be the county that kills their animals because they're either stung to death by wasps or because they're frozen. I also wonder, do we have any recourse against the design of the building to help you cover the expenses on the roofing? I know it's been a while since it's been up, but I wondered if it is a design flaw, if we had any recourse to maybe have them go 50-50 with us to get that repaired.
The building's reaching 17 years. The fact that it wasn't caught sooner is the issue. So here we are at 17 years going, hey, you can't go back to a builder now, and being like, what were you thinking?
Well, why can't you go back to the builder?
Because of the length of time it's been since. it
Have you
passed.
tried going back to the builder?
I can ask them.
Have you said that, this is housing counties, animals, and it would be awful if this happened? And do you really want your name associated with design flaw, even though it took us a while to figure out where it was? I mean, the answer is always going to be no if you don't ask.
Okay.
And it'll probably be no when you ask, but at least you've asked.
No, I understand.
And even if they can just come up with 10% of it, anything for, bad press is expensive. So,
Correct. I'll speak with building management and see if we can go back to the company through that route.
okay,
And see what they say.
all right.
Dr. Silva?
I love that idea. I think that's great because a bad press would be bad for them, especially with County, such a large customer. I think you have, at least I can speak for myself, folks on the committee who would advocate for the county helping us out. So from my standpoint, let's get it fixed as soon as possible, so we don't have $20,000 every month of something that we're never going to recoup. So this does sound like an emergency, and we definitely need to care for the welfare of the staff and the animals that are under our responsibility. So I would completely agree with Mr. Tepe's idea.
Of course.
Mr. Sanchez?
Thank you, Madam Chair. I also agree with this as an emergency purchase, and I think in our COVID savings fund, as we kind of generally call it, there's plenty of money that could cover this.
Yeah.
And I think that would be a very appropriate use of that type of reserve fund. So
So I'm hearing a consensus from the committee that we should look for you not having to fund it yourself and looking for other sources.
Thank you. I will put forward a resolution next month to put that out there. And I have to give credit to Henry's group. This crew with their new hands-on being preventative maintenance is the ones who caught this. I mean, this
Good.
could have been caught in November, December. And we are very lucky it was caught now. And I'm very thankful to that department for what they do now, because he really has that crew on top of things. And it's fantastic from a building standpoint to know that these little things that I don't know about are being checked. And it has been wonderful. And I have to thank them 100% for what they're doing.
A stitch in time, right? So, okay, anything else you want to share with us today?
No, the last thing I have is my presentation for budget.
Okay.
Now you want to ask for money?
Excellent. So I put out our organizational chart just because I always like everybody to know what we have. And on the right, I have to point this out. When your business has finally hit Hot Wheels status, you know you've come somewhere. Hot Wheels just came out with their animal control vehicle. I was excited. So that's part of the reason I left this in. Because Matchbox had it for like 2-3 years. Hot Wheels finally got us. This is our year-to-date revenue versus expenses. Just a quick look at everything keeps going up. I think we all know that. These are our revenue projections for the 2024 year compared to the 2023. 2023 was your step one process, so I didn't put it in as step one. I just left it as 2023. And the 2024 is actually the step two. That's with the finances added for all the departments. I know HR has not completed their study yet for salaries, so we do expect there to be a change when we get to expenses with the salary side of it. The revenue increase this year was the resolution you passed last month for the change in fees, which will help fund the expenses going up across the board through our department. And we see that everywhere. Some big things we've realized is interest being decreased is a huge loss. And part of that is since COVID, interest rates have not returned. So our investment on money has been much lower. So we had to properly adjust for that. And the other thing was our fines through the court systems have been decreased. And we had to, again, reflect that here in our budget. Sorry, jump to. On the expenses side, personnel is of course our largest factor of our whole entire budget. Contractual is up this year. That's because the services we contract with, veterinary care, other services along those lines, Chameleon, our computer software, prices are going up. And as their prices go up, it forces us to pay more for those services. Commodities are up, again, because the same thing, we're seeing animal care supplies, we're seeing price of dog food, you've all seen this, vaccines, they're all going up. Come the first of the year, we're waiting to see where the rabies actual individual dose fees go to see if for our low-cost clinics, we need to increase that slightly. Again, we want to keep that as low as possible to ensure that people continue coming to those clinics that can't afford those services. Yes,
Dr. Silva.
sorry.
Do we have unfilled positions?
We do have one unfilled position at this time, and it's a part-time kennel worker. We've already made the offer. We're waiting on background results now. And as long as everything clears and his paperwork clears, we're good to go. And then we'll be fully staffed for the first time in, I think, 3 or 4 years.
Congratulations.
Yeah, that's wonderful. And I just wanted to draw to your attention, I don't remember all the specifics, but I know in Human Resources Committee, we're looking at sometime possibly taking away those positions that have been vacant for a while. So I wanted to let you know that that's going on, and I'm glad that you're.
Oh, no, I totally understand. Yeah, we're a very small department, as you can see. That's where this becomes beneficial. We only have 2 full-time kennel workers. It's really those part-time kennel worker positions that are literally Saturday, Sunday that are constantly turning over. But that's how they were designed, bless you. They were designed to be positions that were college kids. And really, we get a lot of Aurora University, Elgin, and some of our other colleges in the area. Those are the students we get where they go to school all week, they come in on the weekends, but then unfortunately they graduate and they move on from us, which is understandable. So that's why it's a high turnover position. So we expect it. It's just hard to get all 3 on board. And this is why we're excited that maybe for the first time, in 4 years, we may have all 3 positions filled.
Good.
The cat, troublemaker, but you see he brought his own chair.
Mr. Roth, would you use your microphone, please? What did you say?
Said, how's that one part-time worker up there on the bottom left working on?
Does their own thing. They don't
That's the
always
real
listen.
boss.
Yeah.
The other thing is our capital expense. I wanted to point this out. There's a change to next year. The 15,000 was actually a carry forward. We saw that in our revenue for this year. It was carried forward for the concrete work that due to COVID, supplies were so limited on concrete. That got pushed back 8 months. We got it this year. We're very excited. I have a picture at the end of the slide to show everyone. It's silly, but we love our concrete. We got it fixed. The 50,000 is actually for the parking lot. The parking lot is now 17 years old and on a blacktop that is long past its end of life. We're starting to get Grand Canyons in 2 different areas throughout the parking lot. One is right in front where the handicap parking spot is, not a great location. The other is an employee area. So we want to clean up and ensure there's no issues, no one trips, falls, gets injured. 50,000 is gonna be a lot cheaper than a lawsuit. So we figured that that was the way to go to get that fixed. So that's on our list for next year. One of the things we do worry about is the transfer to other funds this year, the IT, that's the IT service resolution. The raises haven't been approved by the board for this year, any cost of living. The HR study has not been completed. So we are preparing and at the same time nervous about how high that fee is going to jump. So stay tuned. But as for right now, we're able to comfortably still handle that with the increased tag fees. No change in positions. We have not changed positions in the 9 years I've been here. I don't see this changing. We're a skeleton staff. It's working well. There's no reason to change it. Animal control, again, our big thing is the purchase of those rabies tags. That's 98% of my budget. As long as we continue to ensure we get that in timely fashion, we'll continue to ensure that animal control can continue to maintain, keep the lights on and all that fun stuff. And again, with the tag fees going up, we hope to ensure we continue to keep those senior tags free throughout the county. This thing doesn't always like it. And there's new concrete. Our trailers are actually our county animal response trailers are on them. Those are the trailers. We're hoping to put together a new video because it is safety month. So we're hoping to put together some new animal safety videos, in which case we're going to showcase off all the ability those trailers have. If you were at South Elgin this last year for National Night Out, we had it there open for people to walk through and the kids love to play on it. And the year before we had it at the sheriff's office, the year before that was Campton Hills. We're trying to get it all over the county so that everybody knows that in an emergency, we at least have some capabilities to be able to take care of the animals in this county. And that's all I have. If anybody has questions for me.
Any questions? Okay, thank you for your report.
Thank you. Thanks.
Okay, and moving on, we move to Michael Isaacson, Executive Director, and any updates.
Great. Good morning, everyone. Nice to see you all on this beautiful rainy day. I'm really excited today. I have almost our full leadership staff here with us, our senior leadership team. So a couple of new introductions to make for you. I'll start on my right-hand side next to Ms. Molina over there. We have created a new division called the Division of Planning and Information Management. When I took this role, I really expressed to the board how important it was, I think, for us to do more to get relevant information out to stakeholders. So whether that's you or municipalities or even internally looking at how we evaluate our programs and make sure that we're doing the best we can. So I'm just thrilled to introduce Liz Alleman, who is our director for that new division. She's a trained epidemiologist and has been doing a fantastic job just in her first few months here at Kane County. So we're just thrilled and you're going to see a lot of new things coming from her office. So welcome to Liz.
Welcome aboard.
Thank you.
I don't want to skip over Uche, but I think most people know Director Onwuda, who's not new. She's been around. Even when I was a college intern, I walked into the health department when I was in graduate school, and I said, I have to do a report on Kane County, or maybe I was doing it on the city of Aurora. And they said, oh, you need to talk to Uche. She'll give you all the data for that. So Uche and I have been around for a while, but you know Uche. And some of you may have had the pleasure of meeting Kim Peterson. So Kim is our Director of Community Health, which is our division that does a lot of our community partnerships. So this includes early childhood, chronic disease, including our participation in making Kane County fit for kids, and then our expansion into mental health and substance use services. So Kim's been with the health department for several years, learned all kinds of things during COVID and was able to pivot and change jobs like everybody else, but Kim has just proven herself over and over. Most recently, she's been the champion for the IRIS electronic referral system, and has just been doing an amazing job getting that out into the community, where we're over 6,000 referrals, I think, and yeah, almost 7,000 referrals through that system. So Kim's a clinical psychologist, has one master's degree, is working on another one right now. Soon. So really strong team we have here. So I'm just thrilled and welcome to Kim to the group too. And then of course, Laura Barrett is our director that manages disease prevention. She's not here today, but I think you all know her. So really excited just to have a strong senior leadership team at the health department. We've got some great assistant directors as well. So
A good team makes all the difference.
it makes all the difference. Yes. So I can sit back and take credit for all their hard work. Yeah. No.
Smart. man.
Couple things I want to talk about. The first one's not too pleasant, but we, and many of you know, and we've had conversations about this so-called First Amendment auditor who visited our office a couple weeks ago. If you're not familiar, this is someone who comes in with a camera. They go to public places, libraries, post offices, et cetera, and they film. And their intent is to get a rise out of people, and they post their videos on YouTube. The particular individual who came to our office actually got past a locked door. He went in when somebody else came out, when one of the folks delivering packages came out. So he gained access to an area that's typically secure. So it was very frightening for staff. In the video, they're antagonistic. They keep saying, "I'm just filming." Our staff don't know that. This is a strange person who's refused to leave, who's gotten past. So I want to say a couple thank yous. First, I'm very appreciative for the Aurora Police Department and the Kane County Sheriff's Office who responded to this situation. And I'm very thankful to Sheriff Hain and State's Attorney Mosser and the board for being so responsive after this event happened, that we're having serious conversations about additional things we can do to make our building safer, whether it's signage or cameras or different things like that. So really appreciate how seriously everybody's taken it. But most importantly, I think I'm just really impressed and grateful at how well staff responded in this situation. And I think people handled themselves with tremendous professionalism, and it's something that was scary. We had people who, we have done active shooter training in our office, and we've done like the live version where the police are chasing people around and we're hiding and barricading. We had employees that didn't know in this situation. So people were quite afraid. So I think in hindsight to say, "Oh, I just had a camera," that's nice to say, but you're a stranger who's come into our building and gotten past a secure door. So for the staff who interacted with this person, they just did a fantastic job, and I'm really grateful. So we're looking how we can get better and respond better in the future. But again, I thank all of you for taking this so seriously.
Well,
as
I would like to echo that the staff did just fabulous. I watched the video and I would like to think I would react that way, but I was very, very impressed. So congratulations to your whole team, because they did a wonderful, wonderful job. And they didn't look scared. I would have been shaking in my boots, but good job, good job. So.
Any questions from anybody on that? Okay, just a quick note on the new COVID vaccines that are out then. So there's 2 new vaccines that have been approved, but of course this is being moved over into the commercial sector. So what that means is that the health department will continue to provide vaccine to children through our Vaccine for Children program, but we're not going to be providing vaccine to adults. So we're not really set up to do that. We don't typically do that. I've communicated with all of my peers in the Chicagoland area, and most of the county health departments are not providing the vaccine. We're just not set up necessarily to bill private insurance and do those kind of things. And it is expensive. It's quite expensive for us to just purchase the vaccine. So just wanted to give that update and encourage people that their pharmacist and their medical home is the best place to go to get that vaccine when it comes available.
Yes, Ms. Bates?
Thank you, Ms. Bates. Will most insurance policies be covering this? So if you go to Walgreens, they'll figure out how to or VNA or?
Yes, but of course, that's one of the things where the devil's in the details. So the messaging at the federal level is that most insurance will cover it. But each
Most.
person should check with their insurance to see where they'll cover it and will they cover it,
Because they're very expensive. If $125.
right? That's what we've seen in that $140 range.
Uh-huh. Oh, what age children?
It is 6 months and up,
To,
100,
no, what age
yeah.
for the kids?
Oh, yeah, 6 months.
To 18 to 12?
No, like 100. I mean, for anybody. Oh, you mean our vaccine for children program?
Yes, I am not communicating
I
properly here.
apologize. Yeah. It's,
I don't make myself clear.
no, you're good. I apologize. 18 for that program. And then I just want to give an update. We are meeting on Monday with our executive committee for our community health assessment process. So again, we're working with a new vendor this year. We're really excited. I think there's going to be a lot of good information coming to you from that process. So we will have surveys that we will be sending out. So we'll ask for your assistance in making sure that we get people in your district represented by the survey. So that's important. And then we'll follow up later and be talking about focus groups and different things like that. So just wanted to kind of plant that seed for later.
How often do they do this assessment?
So the community health assessment, we as a certified health department are required to do it every 5 years. However, the IRS requires hospitals, not-for-profit hospitals, to do it every 3 years. So what, Uche, maybe 3 cycles ago, we went onto that 3-year cycle with the hospitals. And we actually received national awards when we first made that transition because we pool funding, and you just voted for this a couple months ago. We pool funding with all of our hospitals so that we're all doing the assessment and prioritization together. So it's a much more coordinated approach that we're seeing. And we like it because we like fresh data. So we'd much rather be on a 3-year cycle than a 5-year cycle. So it works well. All right, I'll just share a few things that are going on or have recently gone on. And this is in our Children's Mental Health Initiative. This is a training that occurred last week. We had 55 participants, which is just excellent, especially when you're trying to bring folks from schools in, because as Mr. Tarver can attest to, it's tough with people's schedules. So this was looking at suicide screening in schools. And we were focusing on some of the great things that West Aurora has been doing. So kudos to Kate McCormick from our team for coordinating this effort. And like I said, 55 participants we're really thrilled with. We're always excited to talk about Walk to School Day. So this, for board members who may be newer, the health department and the county launched Making Kane County Fit for Kids to really focus on how we can improve nutrition and physical activity for young people in our community. We started this in 2009, and Walk to School Day is a one-day awareness event where we really highlight what's happening with safe routes to school and how active transportation to school has so many benefits, not only physical benefits, but also mental health benefits. I like to talk about even some of the research as we talk about mental health. Walking to school or riding your bike to school puts children in a position where they're making decisions. So even the simple things like, okay, do I cut across this person's yard? Do I do this? Those daily decisions help people grow. So there's some interesting research about that, as opposed to what we have so much more of in our society now, where you get in a car and you go to this, and then you go to your travel team, and then you go to this. So kids may have coordinated activities they're doing, but less of that free time. So I always bring that up because I think some of that research is interesting. Fit for Kids is launched as its own 501c3 now. So the health department participates as a board member, and we still provide staff support, but it is its own organization. We just found that would be better for us to be able to write grants and fundraise for this effort. So this organization is providing $150 to any parent-teacher organization that participates. And I fully expect, like it's been for the past 10 plus years, that we're going to have more participation than any other county in the state of Illinois. So this is tracked on a national website, and we always have the best participation. We have great support from county board members and mayors and fire departments and police departments, and the schools really step up to do fun things. We leave it up to them how they want to do it at their own school. And again, we want this to work. So for some of our schools where maybe it's not safe to walk because of traffic patterns and things like that, if you're out on Route 47 or something like that, we still allow people to do creative things to participate, just so we're not excluding people. So this is just a positive thing. And if you'd like to participate, I would suggest you just contact the school that's a school in your district and see what they have going on, because we don't coordinate. We have 80+ schools typically participate. We don't coordinate each one. So.
Yes, Ms. Juby.
So how does a PTO qualify for this $150 to promote this event?
So we have a registration form and it lists the requirements for them. So typically we require pictures, we require some data from them about what their estimations are for kids walking, what are challenges that they may run into, et cetera. And so they submit that form and the photos afterwards. It's on the Fit for Kids website, and I believe we have a link to it on our website.
Okay, so everybody call all the schools in your district
Mhm.
and tell them to hit Fit for Kids. So I'll be making 13 phone calls.
Good, good.
Thank you.
And I can provide a list for you if you want me to save you, because most of them probably participate already.
That would be great if you could get that for me, because I don't want to call them if they already participate, but I have no problem calling the ones that don't know about it.
Thank you.
I'd
Appreciate
like
that.
one too, please.
Okay, very good. So I'll send the list of schools who participated last year. Okay.
And I'm curious how creative they get if they're a bus school.
Yeah, sometimes people will do things, and again, it's a little off what the real intent of Walk to School Day is, because it's walk to school, it's in the name. But we just don't want to exclude people. So they'll do things where they're walking around the building and doing more education around physical activity.
Okay.
But we, if 8 out of 9 elementary, and I should have mentioned it's elementary and middle schools. If 8 out of 9 in a district are participating, we don't want to exclude that one.
Right, right.
But we have thousands of pictures over the years. It's so great. I don't know how we do this with privacy. I'd love to go back to our first year, because many of those kids are in their 20s now. So I'd just like to see.
Dr. Silva?
Thank you. So I would just like to know, are we in communication with our law enforcement partners? Because a lot of, at least in my district, having once walked 6 miles to my job, a lot of, it's not very walkable in
Yeah.
some areas. So to prevent anything, do we have, could we send that out to?
Absolutely,
you.
absolutely. And safety is a key thing. We don't want to just blindly advocate that people are walking. So as part of the work that Fit for Kids does, we've actually given grants to put in sidewalks. We've actually worked with the National Safe Routes to School initiative to coordinate with schools. So there is funding available for larger projects to put in sidewalks, or we've put in new crossing lights at certain intersections and things like that. But yeah, absolutely, we'll follow up.
Thank you.
That's an interesting program. Any other comments about that? Okay.
Next, and we've talked quite a bit about our naloxone distribution. So we have a couple of events coming up. This is just an example of one where we'll be delivering naloxone up at one of the fire departments in Elgin. We are looking at vending machines. Madam Chair Pirog had talked about potentially putting a vending machine here that we could have available to people. We're working with different hospitals to put vending machines in. We're happy to provide as much naloxone as you want for your community. We'll come and we'll do training. So again, this is one of our key strategies in our opioid overdose reduction work, is to make sure as many people have naloxone as possible. I had family who was at the farmer's market in Aurora last weekend, and they're like, "Oh, we ran into your team handing out naloxone." So love it. And this is Kim's group who's doing this. They're doing a great job getting this out. So.
Yes, Ms.
If
Bates?
if there were a vending machine, what would it cost? Because we're
It'd
giving
be-
it out.
It'd be free.
Oh, free vending machine. Okay.
Yes, Ms. Lewis?
Have we talked to places like Hesed House and Lazarus about
Yeah.
putting it there because they're,
Yes, so we already provide it to them. But yeah, where and there's a whole variety of different quote unquote vending machines from, you know, a box that you can just open the lid to actual vending machines. So depending on what kind of security people have, we look at different models, certainly.
Ms. Juby?
So I just wanted to follow, I was disappointed Laura wasn't here because last month we talked about how cumbersome the packaging is. And so I did reach out to the manufacturer to ask them if they could come up with a more streamlined packaging, and surprise, I've heard nothing back from them. So I will be following up with them again. And because I think a lot of the problem people have is that it's so big. It's hard to have it in your purse. You can't carry it in your pocket. You can't take it out of the box until you're ready to use it. And so I thought, well, we'll just go right to them. But of course, it's a work in progress, but I just wanted to follow up with Laura and let her know that I did reach out to
Excellent.
them.
Thank you.
You're welcome.
And I have done that training with Kim and with Kate, excuse me, and it's easy. It's easy. And I feel like I'm really glad that I did it. So I have that information now.
Right.
It was part of the CPR training too.
Right.
Good,
Right.
good.
And I don't have the slides today, but of course, we continue to see increases. We had a little dip in fatal overdoses. But fentanyl is showing up in more and more things. So this does continue to be a major problem for us,
What things?
the overdoses.
Yes, Ms. Bates?
What things?
No, the fatal overdoses continue to be.
But what is the fentanyl in?
Oh, the fentanyl, it's showing up in more pills, it's showing up in cocaine. So we're hearing anecdotally from emergency departments where somebody may be revived with naloxone in an emergency department. And then they'll swear up and down that they've never done an opioid. Like, I don't do heroin, I don't do any of those things. And that's a scary thing that people are taking drugs, and this is enema that can kill you using it once. And I think we've had the discussion here at this table before in terms of harm reduction. The simplest thing is to say, well, people shouldn't be using drugs. Never in
teenagers
society.
shouldn't be
has that been the
having
truth.
sex.
Right.
Okay.
Exactly. Right. Right. So, and as we talk about mental health and trauma, there's a reason why people frequently will.
So
seek
what do
to
they
numb their
think
pain.
they're taking?
It could be like cocaine or
It's
different
cross-contaminating a
pills.
lot too.
Right. Oh,
So, and I'll share more information in the future if you like. And we're seeing more of the xylazine, the animal tranquilizer, is showing up in fatal overdoses here in our community. So I was trying to give you a break and focus on more positive things today that we're doing. But there's unfortunately, and like as Brett's talked with the animal tranquilizer and the availability of it online, it's also scary.
Ms. Molina?
Thank you, Madam Chair. Director Isaacson, what about fentanyl test strips? What of our, is that something that we would be able to do as in the same as Narcan as a vending machine type of a thing? Or where are we at with the distribution of the fentanyl test strips?
Sure. So currently we are making fentanyl test strips available to our community partners. So we are authorized with the grant funding that we get, which is federal money that comes to us through the state. Fentanyl test strips are allowable so that somebody could see if this is in their product or not. As of right now, we don't have permission from or our legal guidance from the state's attorney's office is not for us to be distributing the test strips. We're continuing that dialogue. And there's a lot of variety here. The test strips, they're being used slightly off label because they're really intended to be urine test strips. But you use them before to test your product. So it's not exactly what they're labeled for. And the harm reduction piece is still an ongoing dialogue, I think. So we're working on that. We just got permission to give out naloxone within the last year. So baby steps, I think, but.
Thank you.
Baby steps, but giant steps at the
Yes.
same time. Yeah. Yes, Dr. Silva?
And I believe I've mentioned this before, but in my research, Crackum in higher doses mimics opioids. I don't know if that's exactly what happens, but there's something there. And then I think it's Imodium that also in high doses can mimic opioids.
oh my God.
So those are things that if we could start to do a little more research on that so that we can then flag that down to our state representatives to see if we can put those behind. But something to just kind of draw to your attention to.
All right, very good. Thank you.
Yes, Ms. Lewis?
so since we're on the subject of overdose and death, I want to put in a shameless plug. There was an article in the Connects last week, and it's in Shaw Media this morning. Rob Russell, the coroner, and myself and Lindsay Johnson, who's a student who's going for her master's. We're going to start a bereavement support group specifically for people who in our county that have had a death from a substance abuse overdose. It's a interesting group because they don't grieve like other people because there's so much stigma still attached to it. And so we're starting a pilot on it. And if anybody has somebody in that group, just get a hold of me and we'll get a minute. And then we want to go forward with this stuff. But I want to applaud Coroner Russell because yeah, it's just another way of thinking outside the box of trying to do this. And the other hope that I really hope happens. A lot of times when somebody dies of an addiction, there's somebody still using, and that maybe we can get help to them because we will have, avenues to get to them with that. So I'm just really excited to, be part of that group.
Keep us posted about that. That's
Absolutely.
that's a good program.
Absolutely.
Okay, back to you.
And I will make one more note. The board did approve several months ago for us to engage in a community education and awareness program around opioids. So we are moving forward with that. As we've worked through the design phase of it, we're starting to do videos. We have 3 primary audiences that we're focused on. We've taken different courses. We've given some pretty strong feedback sometimes. But what we really want to do is be supportive. And there's a lot of people that we hear from who get into treatment, and that's ultimately what we want. I'm not here as the health department director saying, yes, everybody should just use drugs and that's fine. We'd like people to get into treatment, and we need people to be alive so that they can stay in treatment. So we are going to be doing a webinar with Lighthouse Recovery within the next month. And then also as part of this campaign, we're focused on active drug users so we can get them information about how to get into treatment. We're focused on friends and family, or that support network for people. So as Ms. Lewis is mentioning, this is very hard on families. So not only have you lost someone, but just struggling through it. And also on professionals is the third group. And in professionals, I'm talking about police officers, emergency department staff, et cetera, because they're on the front line. This is very taxing for them to deal with, and it can be frustrating. And I was just with the police chief in Aurora yesterday, and when the EMS lead for the fire department, but they're talking about 75% of their calls involving some substance use or mental health issue. So that's taxing and it's frustrating. So as we talk about stigma, it's how do we connect with these professionals so that we can say, yes, this is frustrating, and you may be seeing the same person over and over. And again, a simple thing for us to think is like, why doesn't this person just stop? But it's much more complex than that. So we want to provide supports to police officers, supports to our emergency rooms, so that they have tools so that we can make a difference. Because if our professionals who are on the front line of responding have a feeling of hopelessness, that makes improvement that much harder. So in the next month or 2, we'll have a lot more we'll be sharing with you about that.
Good. Yes, Ms. Juby.
Sorry, I seem like I'm talking a lot. I missed the section on the suicide and the mental health outreach. And I know we talk a lot about meeting people where they are. And I just wanted to put in a plug for what the state of Illinois did. The state of Illinois dedicated some money to give to the Future Farmers of America, the kids, gave them $1,000 grants so that they could actually get training and go out in their community and reach their parents and reach their neighbors and things, because young adults are less likely to be carrying the same stigma as the adults. And I know it's not an agriculture meeting right now, but farming is incredibly dangerous and has a very, very high suicide rate. And so when I hear like what Ms. Lewis is saying about how we send out and we reach people where they are, I think we can reach people in cars at clinics when they're getting their dogs and cats done. I think that any way we can think outside of the box to try to deliver a message that removes a stigma or gives someone a piece of information that maybe they didn't know they needed. So just wanted to bring that up because I thought that was an incredibly brilliant plan to reach the kids. So, thank you.
Thank you for sharing that. Anybody else? Mr. Jarrett, Mr. Jarrett Sanchez.
Thank you, Madam Cheryl. Mike, I'm aware that police departments, fire departments, I think they keep track of people that they see regularly. I believe that's called, what is it, frequent users of
Mhm.
emergency services?
Fuse. Mhm.
Yeah, Fuse. Do you guys get those numbers from the whole county?
We don't have it for the whole county. No, there are active programs in Aurora and Elgin that have really looked at the frequent utilizers. I don't get that report on a regular basis,
Okay.
but those teams, I mean, they know people on a first name basis, because unfortunately they are picking people up maybe multiple times a week, whether it's police or EMS. They may be in a bed in an emergency room. So again, just taking one of those examples, that could be very frustrating to people, right? I've seen, I've seen Brett 10 times in the last couple of months. And as we look, and when we first started working on Fuse 15 years ago in Aurora, we had 10 people who were costing about $1.5 million a year. Right. So you just look at the number side, forget about the humanity side of it for a second. It's incredibly expensive for us to provide these services. On the flip side, and when you look at the more human side of it, everybody's doing their job. So EMS or police will pick the person up, the emergency room will stabilize them, and we set them loose. But we should fully expect that we're going to see them again because nothing's changed. Right. So now what we're trying to do is get interventions in place, such as projects like our peer support in the emergency rooms, where we can say, okay, when we get them in the emergency room, what can we do to increase the likelihood that we can get this person help and get them out of this situation so we're not seeing them again? That's easy things to say. You've got housing, you've got substance use, you've got, trauma, plus maybe years of trauma of living on the streets. But there are models around the country that we're trying to replicate to get people into services. But some of these things, especially housing, is really tricky, and we're doing a lot of work. There is a lot of work. I shouldn't take too much credit. There's a lot of work going on in Elgin where they don't have a shelter. In Aurora, we have a low threshold shelter with Hesed House, but up in Northern King County, we don't have that. So people who maybe have a more colorful criminal history, maybe not welcome in some of the shelters. People who are active drug users may not be welcome in the shelters. So again, the easy thing is to say, well, you should just quit using drugs if you want a nice warm place to sleep, but that's not reality. So the reality is we have people in our parks, we have people on our streets. And as we look around the country, nobody wants that for a variety of reasons, right? So this is something we're going to be putting a lot more energy into trying to figure out. But back to your point, sorry for such a long answer, but back to your point, we do know, but I don't get those reports regularly, but we could get them.
Yeah, I mean, just when you say that 75% of calls in some of these departments are, addiction and mental health related, that's significant. That's
And the training in our first responders has been increasing and improving, but stigma is a big issue that we run into for people. So
Yes, Ms. Bates?
Thank you, Bates here. So does this tie into our new vision for our mental health services that hopefully we can help these people?
Absolutely. And again, I think the sticky piece for this is housing and trying to figure out for a health department or for a county, what's our role in some of those things. So we had the housing summit about a year ago, right? But there's not easy answers. There's maybe things that need to happen on a federal level, on a state level, and things we can do locally. So I'm conservative in how we as a health department approach that, because we could get full-time into housing, right? Because the need is so big. And
Yes.
I don't know strategically that that's where we should be. But a lot of people that we run into, and even people who are in a house or people who may be couch surfing or people who may be multiple families in a house, that the pressure of paying for rent is just so big on so many families that it really is. And this is a national issue. It's just really hard on people.
Well, and it's a very complicated issue because it's not just one person.
Right.
It's, it's the rest of the people in their lives, whether they're the parents or the children or the neighbors or family members who are trying to support. It's very complicated.
Right.
So, yes, Dr. Silva?
I'll say one more thing and then I promise I'll shut up. Hopefully. So I'm encouraged to see that we're looking at our own staff. I think that's one thing that we can do as a committee and as a board. I've always advocated for health department staff because I know the work you do. I was right there in the trenches with you many, many years ago. And I've always said, you don't know what good a job you're doing until you stop doing it. And you were stellar during the pandemic. So I'm so glad to see that now we're officially recognizing the importance of first responders, last responders, 911 operators, public health, because this really is something that we take home to our families. This is something that affects us, our mood when we're then dealing with our children. So it's so important to provide that safety to our patients, to our staff. And I don't know if you're done. I don't want to cut you off, but I will have that same question regarding staff for you as well.
Okay, very good. Thank you.
Very good point. Very good point.
So I'll go a little more quickly here. In our training series, I put these just in chronological order. So I mentioned the suicide screening in schools. This is the next one we have come up on October 11th for coercive control. So for health professionals and leaders in the community, this is part of our work with the Children's Mental Health Initiative. We do have a communicable disease conference that Director Onwuda's team is hosting. Uche, is there anything you want to say about that? Looks like you're on.
Good morning, Uche Onwuta, Director of Health Protection. Yes, this community health, communicable disease conference is a way of communicating with, providers, be it nurses in the schools or long-term care facilities, and, bringing some speakers from outside the county, state, or, and bringing them to the same. We did a couple of them virtually because of the pandemic. This is our first time being in person. And they've always found it very useful because we bring in speakers that they don't ordinarily would have the opportunity to hear them speak. So just stay tuned because this would be a good one.
Great, thank you. We do have these, I don't know if you've heard at schools, they do these wake up calls, which parents absolutely love. So we're partnering with Northwestern to do one on backpacks. And, I don't know who has teenagers or if you've had teenagers recently, but the number of ways that people are able to hide vaping devices and drugs because of the internet is pretty wild. So educational opportunities like this that really give families information about things to look for are typically very well received. So we'll be hosting that at the end of October. We're excited. We're doing an emergency drill. Yes, we just came out of the pandemic, but we need to keep our skills sharp. So this is going to be around anthrax, where we're typically when we look at anthrax, we do worst case scenario planning, like, oh, if somebody dumped this out of an airplane over a large population, we have about 48 hours to get antibiotics to people. So antibiotics in this are going to be Play-Doh, and then there'll also be candy available. So we're encouraging people to register and participate in this. Hope it's going to be a fun event. So even for kids, it's not going to be scary. It's going to be something that people can come and go through and pick some things up. So Liz's team's been working on this. I think it's going to be really
fun anthrax.
Fun anthrax. It's the fun kind of anthrax. Exactly.
Pixie sticks, right?
Yeah, no pixie sticks thrown in the air. Exactly. There was just an article in Kane County Connects, but with our violence prevention program, we are getting gun locks from the state of Illinois for free. So just like naloxone, we want to get these out. The team's been doing a great job getting them out to gun retailers. We had, I think, 4 people came in like just the other day, right after we made the announcement. So, and I think Mr. Surges mentioned this when he was talking about, for people who are gun owners in this community, we don't want, and the board had a discussion around Ethan's Law, we don't want kids or people to accidentally come across a firearm and potentially injure themselves. And something like a gun lock can be one of those things that puts a little pause in if somebody's looking to harm themselves. There was good discussion about getting And we're exploring this actually with stickers and things like that so that maybe people can have information about suicide hotlines, just something to pause if somebody does have that suicidal ideation, because guns are the number 2 method of suicide in our community.
I don't want to know what number 1 is, but what is number 1?
Hanging.
Okay,
What was
I
it?
know
Don't tell
I
me, but
didn't
what
wanna
is it?
know.
Yeah,
Sorry, what was number 1?
it's hanging,
I
unfortunately.
knew I didn't want to know, Madam Chair.
Yes, Ms. Bates.
So have we, could we have more education around the fact that homes with guns, in homes with guns, men are 8 times more likely to commit suicide and women are 35 times more likely to commit suicide. So you can put all the locks on your guns that you want, but you still got the key. I know you're saying, well, it might give you pause, but I really think a lot of people shouldn't have guns in their homes, locks or no locks.
Yeah, I think from a factual basis, there's absolutely no refuting what you're saying, right? If you have a gun in your home, the likelihood of violence, including self-harm is greatly elevated.
8 times for men, 35 times for women. Okay,
Yeah, and we definitely can push more education about that as well.
okay, thank you.
We have a hand up from Mr. Doherty.
Yeah, I've heard this false statistic quoted multiple times in this boardroom, and I got to say something. Please stop it. It's a made-up study. It's not true. Okay? It just so happens to be that way. Causation is not the same as correlation. Please stop quoting false quotes trying to scare people. Thank you.
That's your opinion.
No, it's a fact.
So I think this does illustrate that there are very strong feelings, and we can get into the studies, and I'm not refuting Mr. Doherty, but people in this is a hot button issue, right? And I always bring up, I'm from Idaho. Everybody has guns. I grew up with 20 guns in my house. It's people have strong feelings about this. So as a health department, we want to stay out of that fray a little bit. And still, just like we talk about harm reduction with substance use, what can we do to make it safer for people? So I'm not signing up to go and check people's houses and take guns away from anybody. But if we can make it safer for people, including law-abiding gun owners, that's what we're here to do. And now I'm ready for a budget presentation.
Okay.
All right. So as my colleague at Animal Control mentioned, we still have some variance in the numbers. So in terms of raises, we are going to be entering our 3rd year of our union contract. So we already have a contract, but some of those numbers aren't reflected yet. Some of the increases for non-exempt employees are not there. And as I'll talk about in a moment, because we're largely personnel driven, that could be a fair amount of fluctuation. But my key point, I think, and I'll just start at the lower line there, the property tax line. We also are a special revenue fund. We get just under you've heard me bemoan this fact before. We get just under $2 million, just like we did 5 years ago, 10 years ago, et cetera. That's our support from the county. Then you can see the yellow bar is permits, which is starting to go up a little bit as we start to see some growth. Grants are how we are largely supported. So we go out and get our own grants from the state, the federal government, private organizations, et cetera. A little bit of funding from fees. And then you can see some fund balance utilization. A large part of that is timing. So many of our grants aren't on the same year as the county's fiscal year. So we may get paid for something in 1 year, but then the expenses are actually paid. So we need to carry those funds forward and then transfers in. And you can see the big bump there in 2020 is CARES Act funding to help us address COVID. You can see just generally how we're starting to normalize a little bit with the COVID situation resolving itself a little better. So we're looking at about a $9.5 million budget. And I'll reemphasize this when I cover the main points on my last slide, but we balance our budget. So the county's giving us $2 million. we're responsible for going out and finding the rest of that money ourselves. We always have a balanced budget. And so I'll just say that. Expenditures, similar story as we saw on the revenue side. You saw a big spike in 2020 as we started the big initial outlay of costs for both equipment and for contract employees. But starting at the bottom, we're largely typically a personnel driven organization. So that dark blue at the bottom is typically always going to be our biggest expense. Contractual is starting to normalize a bit now. So you can see it was a much larger portion of our budget during the pandemic. We're projecting into 2024 that that's starting to come down again. We do have some commodities which also spiked a bit during COVID, but still quite a bit smaller portion. And then transfer out would be things like IT or if we're providing grants to other county departments. Here is the slide that's provided to us by finance. Again, there's going to be potentially, when you start talking about 3% here, 3% there on almost $5 million, you're talking about real dollars, right? So that these numbers could change a bit. I do want to make a comment about the vacant positions. Some of these are positions that you just approved just last week. So, and I appreciate the board's support for this. Again, anytime we're coming and asking for an additional position, we're doing that because we're telling you that we can support it with our existing funding. We need more funding to expand and offer more services, but anytime we come with a position, it's something that we can take care of. This also includes like 5 intern positions, because now that we have paid interns, those are considered seasonal employees. And then we do have multiple positions in here where we have, and I'll use our environmental health inspectors as an example. We have positions that are open. We need more people. And this isn't just limited to the environmental health, but our pay just isn't as competitive as other communities. So I know this is something that you hear at other board meetings, but we need to do more to recruit and retain people. We need to be able to pay more. As I mentioned, we're not self-funded like animal control typically is. We do get support from the board, but that hasn't changed in 12 years. So as healthcare costs have gone up, as people have gotten raises, you know, the net support or the net worth of some of that funding hasn't increased. So just like many other county departments, we're in a situation where we have people who, when they talk to us about interest in a job, once they find out what the salary is, they may not even show up for their interview. So this is something that just structurally we need to be able to change as a county. And then as Brett mentioned, we're also waiting for the results of the salary penetration study, because this isn't just frontline staff. This is for our exempt employees too, our ability to recruit and retain people. So just a couple of highlights. We emphasize this over and over and over again. We are running a balanced budget. And so if we have less revenue come in, we cut costs, right? If a grant goes away, we cut the costs so that we can manage that. We're constantly looking for new ways to fund things. So we're pretty good at going out there and getting grants, but that's not something you can live on. That, you know, for me to go out and get a 2-year grant and then say, oh, I'm going to hire this person and train them. And oh, by the way, I may lay you off in 18 months. That's not appealing to people. And it's not a way for us to function. So we need more. If we're going to grow and if we're going to do some of the things that we've talked about here at this board, we need more sustainable money to keep us going. But we will continue to reach out and try to find the grants because I think it can be a great catalyst for change. Community partnerships continue to be the primary thing I think I've mentioned. DuPage County has 600 employees. Lake County has 900 employees. Those places aren't even twice as big as us population wise. And, you know, they're 8, 9 times, 10 times as big as us staffing wise. So it's something that we really depend on our community partners and do a lot of community interface that way. Our budget mandates are supported by this budget. And then finally, we're really focused. We were the first county to be nationally accredited in the state of Illinois. you know, in truth, Chicago was before us, but they're not a county, so I'll just, I'm weaseling
it,
some
we
words
get
here,
it.
but we were, true statement, we were the first county to be nationally accredited in the state of Illinois. So our focus on continuing to get better is there. And this budget gets us off to a good start. So happy to answer any questions.
Do you have any questions? Okay. Looks like you're doing a good job.
Good people. That's,
You guys are doing a good job.
Madam Chair.
Yes, Ms. Bates.
This is maybe off topic a little bit, but how are we doing with that? That grant is called the SMAS. Did we get it in by September 15th? This is for the asylum seekers.
so we have reached out to all of the communities who were seeing asylum seekers. So Aurora, Carpentersville, and Elgin primarily. So we did not apply as a health department, but we did support Elgin with their application to be able to do that. That's the only one that I'm aware of that went in. And it's partially a capacity issue for us too, but largely these things are happening at the municipal level where a lot of the support is. So that's how we approach that.
Oh, I'm disappointed. Thank you.
And it is a need. We did, and I don't disagree with Ms. Bates. As we see people come into the community who are seeking asylum, it is a tough situation. People are being, I think one tough thing is federal regulations that aren't allowing people to work, because these are people who are here legally. Some of them have great skill sets. They want to work and they're not allowed to work. So that makes it very hard to settle in. But it's a case just capacity wise where we couldn't take that on as our primary, but being more of a support to the municipalities is a tough decision that we had to make. in
Is
that
it
case.
too late to get anything for Aurora then?
No, I think there's going to be other opportunities. I think that's
But
just
not
one
this
opportunity.
grant.
Not that
from-
particular grant, correct?
Yes, Mr. Sanchez.
Thank you, Madam Chair. Michael, when you talked about the difficulty of bringing staff on or bringing employees on for
Mr.
running
Sanchez,
grants.
can you speak a little bit?
Oh,
closer,
yeah,
please?
sorry. Some of these are not very sensitive. When you talk about bringing the difficulty of bringing people on to manage grants would it make more sense to have maybe a small team of grant managers that just handle all or many of the incoming grants that normally would require new hires? And just, a team of flexible people that would require a budget increase, but would that be something that would help? Or what would be a solution for that?
Potentially. I mean, I think being more competitive with our salaries is something that's important. I'm always bringing up that we have a pension. It's hard to find pensions now. Young people don't care about that, even though it is a great long-term benefit for being a county employee. I think with the amount of job switching people do, salary and flexibility are the two main things people are looking for. Kind of the universal approach like you're talking about. Yeah, I think there's some merit in that, having people who can potentially work and maybe we theme some of the things we're doing. So we have people who can manage different projects, but it's still, and my wife works in the theater, so I know it's still where you're out auditioning for your next gig. So we would be bringing on employees without the promise of long-term employment, which is always a little bit tricky.
Thank you.
Any other comments or questions? Okay, thank you. A lot of good information today. Lots of good stuff. Okay, is there any old business to bring before the committee?
Oh, I do have a resolution.
Oh, I'm jumping the gun here. Sorry about that. So we do have a resolution this morning. Mr. Isaacson, you want to tell us about that?
Absolutely. So this we're looking as we wind down from the large expenditures that we had during COVID to be able to manage our call center when we were investigating all of the COVID cases. Now we're really focused on outbreaks. But as part of our customer service, we want to assure that we have capacity and the ability to respond to public calls. So this is something that we'll be transitioning and looking at continuing to work with a company that's called T-Tech. They've been like a subcontractor from our work with KPMG. But as we transition, this would give us the ability to have offsite people who are able to answer phone calls from the public so that we can assure that that's being responded to. that people aren't, getting in that death spiral of the, press 1 for this and press 2 for this. But that if people call, they'll be able to get to a person who's able to help them. This is within our current budget to be able to do this. T-Tech, again, we've looked at multiple different entities out there to see who could do it, and working with this group. Continuing the relationship with this group is a seamless way to do it, because we have people who are already trained in the health department way to do it. So you can see the cost for 1 year is $41,800. And I think this is something that's going to be really valuable for us to, again, focused on customer service.
So I'd like a motion. Oh, yes.
Oh,
Let me,
go ahead with
I'd
the-
like a motion and a second, and then possible discussion on this. Motion.
moves.
Sanchez moves.
Be second.
Silva seconds.
It's fine.
And Mr. Tuppy.
Michael, how would this work, or how does this work? So where do they call into, and then how do you get a response from them?
Sure. So it's cloud-based. So they call in and it actually goes, and most of these people are working from their homes that we train to do this. So we have a phone line that's set up, and the calls are just automatically routed to these people. And then they have a management team that's in close contact with Director Onwuda's team, where any questions that come up, if it's something that's outside of their training, we can follow up with them and make sure that we have the appropriate answer for people. But otherwise, most times we're able to resolve these things. We use Laserfiche typically internally to manage things. So if a call comes in, we can actually, it's almost like a ticket system where, hey, this needs to be addressed. Currently, the model we're using is these are topic areas. So this may be a food establishment that has a question, and that gets routed to the appropriate person within the health department to be able to respond to it.
And how many calls like that are you experiencing now?
And one thing before, and then I'll defer to Director Onwuda, this would be scalable for us. So one thing we like about this model is if we had something big going on in the community, we'd be able to bring on more people quickly. That could be something that's within the contract. But also we can bring it down to a minimum if not. But what do you think for normal calls? And I can pull up.
I can't quite tell you how many calls we have right now. I don't have the data in front of me. But, remember when I believe it was 2020, when we had a sudden surge and we were trying to manage, so we want to have a structure in place, that, right now when the calls are low, where we have the system working so that we can ramp up when we need it and then bring it down when we don't. So, yeah.
So like last Friday, we had 18 calls. Just one day.
Ms. Juby?
example.
So does that go to the 10-digit number, or is it a 3-digit number? So it goes to the normal health department number they call, and then it gets, do they still have to press like 1 for whatever, or 2 or whatever?
Right.
Like how else would you know
Where to get.
where it should go?
Yeah,
Right.
and this includes some off hours time at the health department too, where we wouldn't have that phone tree, but you still hit I guess I shouldn't make it too late. You still hit the initial phone tree.
Right.
Yeah, good point.
Silva.
Shouldn't make promises I can't keep. I didn't know. Okay, I think this is exactly the type of administrative tasks that need to be put in place in order for departments to function more efficiently. This is something that I've looked into my own practice, and it has helped us out so much. So I am very much in favor of this if you have the budget for it. Number one, it de-stresses staff. Number two, calls are answered quickly and efficiently, and they're routed very, very fast to the people that need to the folks that need to answer the questions that are being asked. So I think this is a very good example of what fast, efficient service that we can provide for the benefit of staff that can be freed up for more high-level tasks that they're trained to and have the opportunity to do, and also get some questions answered by folks so that they don't wait in line for a long time. So I'm all for it if you have the budget for it.
Thank you.
And we do have the budget for it.
You have the budget for it, correct?
Yes. Okay. Yes.
I just want to add one thing. It's also a nice point of contact for the community. When during COVID, we onboarded a lot of those folks to Iris. So as they were ill and stuck in their homes, or a lot of seniors, we were also able to hook them up with food delivery or medication pickup, different things that they were in need of beyond their illness. So it's been a really nice way to connect people to more of a wraparound model of services as well.
Especially in a case, I mean, people were so isolated. So to have this service and have a real person at the end of the call is a very good thing. Any other questions or comments? Yeah, we ready to take a vote?
Juby,
Juby, I.
Silva,
Silva, yes.
Tarver,
Tarver's yes.
Sanchez,
Sanchez, yes.
Strathman.
Yes.
Passes.
Okay, it passes. Now I can jump the gun to old business. We have any old business before the committee this morning? Okay. And I'd like a motion and a second to replace reports on file.
Ask for unanimous consent.
Okay, unanimous consent. Any objections? Okay, they're on file. Any new business? Okay, well, we've got a lot of information. Our heads are spinning this morning. We're on a roll. And now we are welcoming the public comment at this point. And I have a list here. Let's start with Miss Jean Meyer. And you will all be given 3 minutes. Good morning.
Good morning. Jean Meyer, Christian Concerned Citizen, RN MS. Most of what I have to say on the COVID vaccine in the WHO comes from the September 13th, 2023 presentation of Dr. Peter McCullough at the European Parliament. Dr. McCullough is the most published with peer-reviewed articles cardiologist in the US. His final 2 points, said first, are 1, the US and the European Union should pull out of the WHO and leave the WHO without dominion over what we do in healthcare. And 2, COVID-19 vaccines must be removed from use due to excess deaths and no new vaccines given. He said there are 2 waves of injury to the world in regards to COVID. The COVID infection that preyed on the elderly and the frail, and the COVID-19 vaccine, which preyed on everyone else. The role of the WHO appears to be adverse in both these waves of injury by operating as a biopharmaceutical complex, a syndicate, which includes the WHO, the World Economic Forum, the UN, the Gates and Rockefeller Foundations, non-governmental organizations that operate as a unit with the Department of State and public health agencies, only listing one here, the FDA, but there's a number more. The WHO got in the way and impeded doctors' ability to treat patients. And 3 years later, the WHO still has no early treatment protocol. Instead, the patient stays home and waits until they are bad enough to be hospitalized. When there are 2 things that prevent hospitalization and death, and those are early treatment and natural immunity afforded by infection with COVID. He said there are 4 major domains of vaccine injury. Number 1 is cardiovascular. And he said prior to the vaccine-induced myocarditis, we knew that if people exerted themselves with myocarditis, they could have a heart attack. Now we have young people that have been vaccinated that have no idea they have myocarditis, and they are dropping on the sports fields with heart attacks and death or serious hospitalizations. Neurological, there's a whole bunch, but ischemic and hemorrhagic stroke. 3, blood clots, he says, like we have never seen before with spike proteins in the clot. That's a bioweapon, the spike protein. The spike proteins, he said, are produced by the shot for 6 months or more. So they keep producing the bioweapon, and they are resistant to blood thinners. This man has patients going on 2 years who can't dissolve the blood clots. And then the 4th one is immunologic. He said 73.9% of deaths after the vaccine are due to the vaccine, and 100% are due to the vaccine if they have myocarditis. The
Thank you, Ms.
Bradford
Meyer.
Hill criteria. Am I done?
Yes, ma'am. Take your time. Thank you.
Okay, I just did want to give Dr. Silva, it looks like the next pandemic might be the Marburg virus, and she's the healthcare professional.
No, you in that step up here.
Okay, next we have Mr. Mike Meyer. You will also have 3 minutes. Good morning.
Yes, ma'am, and I probably won't need all of it. Howdy, Mike Meyer from Elgin. Some people are talking about mandatory vaccinations for this amazing COVID problem coming up. I say, no, thank you. A couple of short points about the new COVID vaccine. The FDA has reformulated Pfizer and Moderna's, and they've approved them for individuals between 12 and older, but there's an emergency use authorization for 6 months to 12 years. But there's no declaration of emergency. That was May 11th of 2023 when Biden said, oh, we don't have an emergency anymore. If King County says we have to have mandatory vaccinations, we are accepting the liability of an emergency use authorized product. I'm not sure that we want to do that. Omicron came out. The new shots are formulated to include a single mRNA, which corresponds to Omicron X Bravo 1.5. But that was a mild version, and it's already mutated. I'm asking you, please don't mandate vaccinations. We must not encourage this deadly vaccine. You can learn from someone else's expensive mistakes. Thank you.
Thank you. And now we have Dr. Sherry Bresnahan. Good morning.
Morning. My people are destroyed for lack of knowledge. Isaiah. I shall.
Dr. Bresnahan, if you could take the mic a little bit closer to your mouth, please.
I shall finish the quote from last month that I didn't get to speak. It's from Dr. Meryl Nass speaking at the elected European Parliament. Quote, One Health is a concept that was created to enable the WHO with these documents to take over jurisdiction of everything in the world by saying that climate change, animals, plants, water systems, ecosystems are all central to health. Also embedded in this concept is a peculiar notion that humans are no longer of greater value than animals. End of quote. Change of subject. January 13th, 2022, U.S. Supreme Court published landmark rulings regarding the legality of COVID-19 vaccine mandates issued by 2 federal agencies, OSHA and HHS. The Supreme Court itself does not issue mandates, only decides if they are legal. OSHA and HHS mandates drive to the core of several fundamental interests, such as the scope and limits of federal public health powers and proper balance between individual and liberty and the public. December 8th, 2021, the U.S. Senate, by majority vote, disapproved of the OSHA vaccine or test mandate. Congress has not authorized OSHA to issue rules that govern public health concerns. The agency exceeded its authority in issuing a mandate. The court described as, quote, significant encroachment into the lives and health of a vast number of employees, end quote. Historically, such matters have been governed at the state level by public health agencies. Supreme Court Justice Mello states, the core issue here is who decides. The question before us is not how to respond to the pandemic, but who holds the power to do so. That power rests with the states and Congress, not OSHA. The court's decision also made clear that broader mandates, whether they relate to vaccination, masking, or testing, must come from Congress or the states, unless there is a clear statutory language that grants a federal agency the ability to issue such a mandate. Justice Gorsuch states, quote, lawmakers may be tempted to delegate power to agencies to decrease the degree to which they will be held accountable for unpopular actions, end quote. Nothing in the court's ruling prevents private companies from instituting their own workplace requirements. The court's decision also makes clear that broader mandates, whether they relate to vaccination, masking, or testing, must come from the Congress or the states.
Thank you. Okay, next we have David Dorn. See him. Mr. Dorn, are you online? Okay, Mr. Dorn, we are not finding you, so we're going to continue to Lori Powell. Ms. Powell, good morning.
Lori Powell. I've lived in Kane County for 20 years. So I will continue to talk about our dangerous COVID injection. So we know on September 12th, Centers of Disease Control recommended the new COVID vaccines. And on the 15th, the Kane County Health Department endorsed the IDPH's recommendations for the shots. So it's well established that the FDA clinical trials for COVID vaccines, which I will refer to as the nanoparticle injections or mRNA nanoparticle injections, were not designed to clinically or statistically demonstrate that the COVID-19 nanoparticle injections prevent infection, prevent transmission, or protect against disease, hospitalizations, and death. And I have emailed this committee, so everyone has this information. So there are 7 references for this fact. FDA clinical trials, US government data, and real-world evidence have demonstrated that the mRNA nanoparticle injections cause clinical significant increases to mild to moderate disease, serious disease, disabilities, hospitalizations, and death within days, weeks, or months of receiving COVID-19 mRNA nanoparticulate injections in formerly healthy infants, children, and adults. Once again, there are 10 sources to back this up. The COVID-19 mRNA nanoparticle injections were administered to civilian adults and children through unlawful human experimentation, specifically where the clinical safety risks were known by the FDA to outweigh any potential clinical benefits, and the COVID-19 injections were administered without informed consent regarding the composition and variability of the COVID-19 nanoparticulate injection vials, the gene editing mechanism of action of COVID-19 nanoparticle technologies, and known harmful, permanently disabling, and/or sometimes deadly clinical outcomes of being injected with engineered COVID-19 nanoparticle technologies. Once again, there's many sources to back this up in that email that I have sent to this committee. In conclusion, Kane County must immediately stop distribution, promotion, access, and administration of these COVID-19 mRNA nanoparticle injections to all people living in this county. Thank you.
Thank you. That concludes our public comments this morning. Yes, Ms. Bates.
I have a public comment. I would like to thank Kate McCormick for coming to Aurora Area League of Women Voters last night on our panel for youth mental health. Great job.
Excellent. We'll pass that along. Thank you.
Okay. Okay.
Ladies here.
I guess we're ready to have a motion to adjourn.
Sanchez moves.
Sanchez moves. Nobody else wants to go?
Second, Juby second.
Yes, Judy seconds. All in favor, say aye. Aye. Do I hear ayes?
Aye.
Aye. Opposed? Okay, thank you, everybody.